Hi, I'm Vicki Westling with City Speaks. City Speaks is a show that has been brought to you by Mayor Rosas and his administration. It's a show to provide our residents with information as to what's going on within the city of Dunkirk, within the mayor's administration, and certainly some of the services that are available to our residents and to our guests and visitors. So today we're very fortunate to have Dr. Mary Ann Spanos here. Dr. Spanos is the director of the Chautauqua County Office for the Aging. So welcome to City Speaks.
Thank you for having me, Vicki.
Well, we're pleased to have you. Now, we talk about Office of the Aging, and as we grow older, we have an older society, and there are more and more people who are considered to be older as opposed to younger these days, it seems. Mm-hmm. The Office of the Aging, you have a mission statement. And basically what it says is that you really want to provide services to the aged. Tell me a little bit about that.
So we're trying to provide programs and services that help people age independently as possible. I talk to seniors, which in our world is people 60 and over. We're all getting there very quickly.
Yeah.
Who have needs. But you ask them, people with chronic conditions, who wants to end their life in a nursing home? And everybody says no. Right. Well, what programs and services then do we need to provide in the community to help people age independently, gracefully, have the best life in retirement that they can have? And that's really, the core of what we're all about is what can we do for you to help you age well? Have, as I said, the best life you can have.
And generally, I know that one of the things after I've done a little bit of research is to try to keep the individual in their own home as long as you possibly can, which may mean providing some additional services. So do you actually do home visits? How do you go about working with the family in order to keep that person in their home?
So yes, everybody who wants services like in-home services through the Office for the Aging, you have to go through an assessment. You also, where our program fits, you've probably heard that under Medicaid or under Veteran Services, you can get in-home care. Well, Office for the Aging was designed under the Older Americans Act for people who did not qualify. They weren't poor enough to qualify for Medicaid and also didn't qualify for another entitlement like a veterans program. Mm-hmm. Now, people have the misconception that only the poor can come to Office for the Aging. That is not true. We serve people of all economic incomes. Now, some of our services are provided on a donation basis, and others are provided, like the in-home services, on a sliding scale according to income. But I'll tell you, even if you have to pay 100% of the cost, you usually save something by coming through the Office for the Aging. Not only we have buying power to usually get that service a little bit less expensive than you can get on your own, but you get some complementary things like our case management services. So if somebody is getting an aid through the Office for the Aging, we might come in and help with a bath or help with chores and, heavy housekeeping. Again, you would pay for that on a sliding scale, but what our case managers do is they make sure that that service is meeting your needs. And if you have any trouble with the home care agency that's providing it, we get to be the heavy. We are your advocate. If the aide isn't doing what you want them to do, it's our job to step in and say, hey, hold them to the line, because older people often don't want to do that kind of thing.
Right, and so you mentioned about some of the services that you can provide. If you have an elderly person or somebody who is certainly, maybe they are on Medicaid and they live alone or they're single, you can find ways to get someone to come in and help them clean their house or help them do these sorts of daily activities that they were not able to do on their own.
Correct. So Office for the Aging, our biggest mission is to connect people with the programs and services that they need, whether they're services through our office or another agency. A few years ago, we developed a program called New York Connects. One number people can call to find out about all the programs and services that they qualify for. And we don't just give you what you're asking for. What we try to do when somebody calls us is see what's going on with them. Often people will call us for meals, and we'll say, well, they just got out of the hospital, and we find out during the course of the conversation they don't know how they're going to get to their follow-up doctor's appointment. Yes, they need meals, but you know, they're recovering and they could also use help with a bath or some other things. So we try to investigate the reason behind them calling us and tell them about things they might not have thought of. Again, we screen them, so if they're eligible for Medicaid, then we kind of push them in that direction because they can get more services. Our funds are limited.
Okay.
Also, if they can get it under veterans, you know, we connect them to the veteran service officers who can help them apply for that. So it's not, and we're trying not to give out phone numbers. You know, sometimes it gets very frustrating when you're given a phone number and then you call that number and they tell you, oh, this is the wrong number, call that one. So we try to streamline it. If you want Meals on Wheels and we know that you're eligible for them, we will send a message immediately to the meals program and they will call you the next day and get that started.
Well, you know, that helps because we have all these calls now and they say press 1 for this and 2 for that, and so that's good to know that you would actually reach out to the provider or the person who can provide the service, and that individual or that group of people would then call the person who needs the help. Now,
exactly.
You have a lot of services that you do. Not only do you do the respite care, but you also help with the families who may be dealing with an older parent or grandparent or a relative or friend. What kind of services do you provide to the families?
So we, under the Older Americans Act, again, we have a charge to serve caregivers. And caregivers of older adults, you know, I have a 70-year-old man who came in the other day who's taking care of his 95-year-old mother. I mean, we're seeing this, you know, both of them could be our clients. But he was looking for services for mom. But it can be a range of things. We can provide some respite, and that could be in the form of in-home care, or it might be adult day services. It could be one of those personal emergency response buttons. They get worried because mom lives on her own, and even though they might be in the same town or not, you know, they can't be on the phone with mom every moment of the day. So what happens if mom falls and then she's laying there all night? That's a big fear.
Sure.
So those emergency response buttons give everybody peace of mind. The client knowing that they can call at a touch of the button, and the child who may be an older person.
Or the caregiver.
The caregiver.
Right.
So that they can get that. We have a big initiative for the caregivers of people with Alzheimer's and dementia. That is a really difficult problem to deal with when somebody has dementia, and it's very stressful. You know, and they really need to understand not only the disease process, but how to keep themselves well so they don't burn out. So we have a dedicated person who provides caregiver support counseling to the caregiver. We also provide training classes. We have a thing called Powerful Tools for Caregivers. It's an 8-week course where caregivers all get together and they run through different issues of caregiving and problem solve so that when it happens, they not only have a network of people they can call on to talk things over with, but they have some tools to help them cope.
Now, we talk about, and certainly Alzheimer's is one of the things that people are so concerned with, and with dementia. And there are people who say, well, they're different. Dementia is one thing, Alzheimer's is something else. But that's not necessarily the case. Dementia is really the umbrella that Alzheimer's is a piece of that. Tell me a little bit about what should we look for, or what when we see certain things, certain issues that come up. What should we look for if we're involved with an older parent or an older grandparent or whomever?
So let's just tackle first, you know, dementia is a greater diagnosis for anybody who has problems with memory, thinking, judgment, anything to do with the brain. Alzheimer's is the most common form of dementia, and there are others. There's frontal lobe dementia. Usually they're named by the part of the brain that's affected. Frontal lobe dementia. Those people don't have any problems with memory. They have more problems with outbursts and just strange behaviors. What I would look for is, we all have difficulty remembering things from time to time. Just having a lapse in memory does not mean that you have dementia. I think that certainly getting lost and not being able to get back to where you started, losing things in the house and not being able to retrace your steps, also changes in personality that sometimes are hard to, first you just think that you just know that person is not the way they used to be. What else can I tell you? Having difficulty with money, changing money, knowing how to make change, simple things. Everyday stuff that you do as a routine is usually not very difficult for somebody with Alzheimer's and dementia, especially in the beginning stages. We think that people lose all their memories, and really they can drive a car and do their routine stuff very easily. It's the things that happen less often that they fall down on first.
So, for instance, I had a family member who went to the dentist, was on their way to the dentist, and on a regular basis, and this was normal, passed this all the time, knew this where their dentist was, but was on their way to the dentist and called. And when my husband answered the phone, they said, "I can't remember where Dr. So-and-so is." And so that's one of the things that you have these lapses. I mean, we all lose our keys. I'm guilty. Gee, where did I leave those keys this time? Or put your glasses down and forget where you put them. So I have them all over the house. So I always have a pair. But that's what happens. Those kinds of things aren't things that necessarily would trigger dementia, just because you don't remember where you put your keys for a minute, because we all get busy with that. But you're talking about the kinds of things like forgetting where the dentist office is, driving the car.
And if you've been there many times and you forget, I think that's it.
Right.
If it's an unfamiliar place to you or only been there once before, and then you can figure out how to find the place, that is probably not dementia. But if you can't figure out how to get the answer, if it's someplace that should be very familiar to you and all of a sudden you can't find your way, that's the difference.
Right. So when we see these things, that might be a trigger for us. The other thing that we talk about, and this has been in the news, is elder abuse, and that's happening. We know that happens. And that's one of the services that you provide. How do you provide services that treat elder abuse? So
there's a lot of aspects to elder abuse. I think the biggest growing one is financial exploitation, whether it's scams or I think we saw this a lot during the economic crisis, family members living off the Social Security of their loved ones, or even stealing money from them, stealing credit cards and running up that debt. And it's very difficult because this is somebody that you love, a grandchild or a child or somebody that you've taken into your heart in another way. So we work very closely with Legal Services for the Elderly, Law NY in Jamestown, and Elder Law and Justice here. We also work very closely with Adult Protective Services and the Sheriff's Department. We used to have the investigator for elder abuse prevention in our office, but that has since moved up to the Department of Health and Human Services. But certainly if you suspect something is not right, the Office for the Aging will convene the partners that we need to help you through that process.
So if maybe you see something or you think, I really believe that, Johnny over here has taken advantage of Mom, Would they call and say,
They can
this doesn't
call,
look
yeah.
right?
We will look into it. We will have somebody investigate it. We get calls from banks worried about people taking money out of their account, big drafts, thinking that they're either sending it to a scam. That's the other thing, with Alzheimer's and dementia is people become a little more susceptible to those things where you get a letter in the mail and it says, send $250, so you can get your inheritance, and they think that that's the truth and you can't sway them from it. So we work, as I used to have Sheriff Gerasi in one case had to call a client for me because they would not believe myself. They wouldn't believe the bank that this was a scam. And so we had to find somebody who they would believe to say, no, don't send your money. This is not,
Right.
you're not going to get this big inheritance.
Right, this isn't legitimate. You do some things now, and certainly you work out of the senior center here in Dunkirk.
Yes, we have 3 offices.
Okay.
Our office in the Dunkirk Senior Center is manned by Kate Finch. I'm mostly in Mayville, but I do come up to Dunkirk. And then we have an office in Jamestown.
Okay, so if somebody is in Dunkirk and they want to take advantage of the services they need to call, they would call the Dunkirk number, which is 363-4582.
That actually rings into our New York Connects helpline.
Okay.
So they certainly can stop in Dunkirk or call the Dunkirk office, but we try to have everybody go through New York Connects because Kate is the one who in Dunkirk who is working directly with people who either get our home care services, need health insurance counseling, need some direct kind of one-on-one help. So we have them go through New York Connects, not only to register them in our system, but if they need Meals on Wheels, that's not necessarily going to happen at the Dunkirk Senior Center. We send that to our partner organization.
So that number, the 363-4582 number, takes them to Dunkirk Connects.
New York Connects.
New York Connects. New York Connects. So that's the number they need to be calling.
Right.
So they, otherwise they could stop in, but certainly that would be the number. That way they could get all the services or the information they would need from that point.
Correct.
Now you're doing some things that deal with health and fitness. Tell me about that.
So we've always, sponsored exercise in and around the county, but it was a little willy-nilly when I came in. We had a lot in Jamestown and not a lot in other places, and so we kind of moved to evidence-based exercise and wellness programs. And what this means is when it's evidence-based, it's going to make a change in the senior's life. So the first thing we took on was fall prevention, and we started with a program called Healthy Bones. It actually was good for falling and also to help people with osteoporosis who are getting weak bones as they age. Because it's not the fall that's the problem, it's what can happen if you do fall, break a bone, and then that leads to loss of independence. So, but since then we've added Tai Chi, moving for better balance. We have a program called Aging Mastery. That's not really an exercise program, although it touches on it.
Okay.
We have a program called SHINE, Senior Health and Nutrition Education, which works on your nutrition as well as keeping fit. And a couple other things.
Right. So really, if someone is aging, they can call Office for the Aging. They can get any kind of services, or they can, if they can't get the service from your office directly, they will at least be put in line with the contact of those who can provide the service. You also provide in-home services for people, or you at least connect them with individuals who can provide in-home services. Meals on Wheels, you coordinate and participate with them. So basically, if I'm understanding this correctly, and please tell me if I've missed it somewhere, that not only do you provide some services, but the services you don't provide, you collaborate with and coordinate with other agencies that can provide those services. Is that correct?
Yes.
Okay.
That's it in a nutshell. There may be some services that just aren't here in the county. But if they are here in the county, we will connect you to them. And we'll tell you if you qualify. We're not going to send you to a service that only provides it for people of very low income and you're not in that bracket. So we know the qualifiers for that.
So, and now income is another issue then. So it doesn't really matter. Someone can be at a lower income or a higher income, and depending on the assessment, you do a complete analysis or a complete assessment to determine what the needs of that individual are, and also which ones that they would qualify for, or what they may have to pay part of, or do you coordinate with the insurance companies also?
So, no. Well, I shouldn't say no. The services we provide through our office are not covered by insurance. Although in the last few years, we are working with some managed Medicaid long-term care plans to provide meals and adult daycare. So we work with some insurance companies to provide some services like home delivery.
So you help facilitate some of these issues.
Yeah, definitely.
So
we are the Medicare health insurance counselors for the county. We're the only certified Medicare counselors. So if you're having any problems with your insurance, we can help you with that.
Okay, now of course Medicare and Medicaid are very different.
They're different, but they work in tandem, and there are things that insurance is our biggest expense as we're working and as we get older. And so knowing how Medicare and Medicaid work together, we will actually help you decide which Medicare plan is right for you. There are also some programs under Medicaid that pay for your Medicare premiums that we can help enroll you in. It's called the Medicare Savings Plan.
Okay.
That will pay it's more than $104.90, but right now when somebody's on Medicare, there is a little over $100 deducted from your Social Security every month, and people of a certain income bracket are eligible to get that money back.
Okay.
They don't have to be qualified for Medicaid, but if they're just above the Medicaid level, they can get that money back. So we try to figure out what's best for you as far as your physical health, but also we want to look at what programs and services help put more money into your pocket, whether that's getting you into the best insurance plan and saving you money that way, or signing you up for, SNAP, which gives assistance with food. We try to know about all the different government programs.
Okay.
Even Medicaid, we don't help with the application for Medicaid, but we can connect you to somebody who does that.
So you really, the services that you provide, they cover the whole gamut for everything. So that's really important. If somebody wants to contact you here in Dunkirk, again, they're going to go to 363-4582, and that takes them to New York Connect.
Correct. We have 3 ladies who answer the New York Connects helpline every day, and there is no press 1, press 2, press 3. If they're all 3 are busy, which does happen, it'll just go to an answering machine and they'll say, sorry, we're getting a lot of calls, leave a message and we'll get back to you. But you know what? If you don't leave a message, we have your number and we'll call you back anyway.
Well, that's good to know. Is there anything else that you feel is important for our seniors to know, for our caregivers of seniors to know in this area that maybe we haven't touched on?
I just want to say that Office for the Aging, your taxes paid for this program. And so we should be your first call if you're having difficulty with any aspect of your life and you need some guidance on what's available to help you.
Okay. And so generally the population that you service, at what age do they begin?
Well, we really serve people throughout the lifespan. The information and assistance is for anybody, we get parents of children with disabilities who call us, disabled adults who call us, caregivers who call us. But generally, the services we provide, like the in-home services or the health insurance counseling, those are for people 60 and over.
Okay.
That's what we have the funding for.
Okay, but you do, so if somebody does have a child who has a disability, they can still call you as a resource.
Right.
Right, and so
Right.
you would provide that.
And
So
we'll connect them with the expert to help them.
okay, so basically your services are pretty much geared towards 60 and over. How many are in our area? How many, do we have a population? Are we able to service all of them, or are there some who are maybe we're not able to reach?
Well, that was true in the past. Since 2010, we have had a wait list for services. But this past year, and I have to tell the citizens of Dunkirk who helped with our letter writing campaign, thank you. The governor put an extra $15 million in his budget this year, and close to $500,000 additional money is coming to Chautauqua County to take care of people who have been waiting for services.
Wow.
So that's a huge win.
Well,
but
thank you, Governor Cuomo.
Yes. So, but generally there are about 30,500 seniors in our county, and that's getting close to 25% of the population. I mean, we're down to 130, a little less than 130,000 people in this county.
Right.
So you're right, you know, the demographics are that the people over 60 are starting to exceed, you know, the people under 10.
Right, so, you know, our population is definitely aging. Dr. Spanos, thank you so much for being here. I really appreciate it. For all of you out there, if you have a problem, if you have a question, if you have a senior that you're working with or that you feel like you may need to be, if you're a senior yourself, you know, if you need help, if you have a child who's disabled or if you're dealing with a disability, Dr. Spanos and her organization, they're there to help you. So thank you. Thank you so much for coming in. We really appreciate it. Thank you for watching City Speaks. You can contact me directly if you have any questions, any comments, any concerns. Call me at City Hall 363-6888. Send an email, vwestling@cityofdunkirk.com. Follow us on Twitter. Like us on Facebook. Our Dunkirk Access team, our crew, are always here to help also. So give us a call. Let us know what you think. And thank you, Dr. Spanos.
Thank you for having me.
And thank you for watching City Speaks.